In 1980, the American Psychiatric Association, also known as the APA, added PTSD to the third edition of its Diagnostic and Statistical Manual of Mental Disorders. Post-traumatic stress disorder is a mental health condition that affects 8% of people in the United States, compiling of about 25 million people. PTSD targets most people that have experienced a life-changing event such as war or combat, serious accidents, natural disasters, terrorism, or violent personal assault such as rape that can cause a person to avoid all interactions similar to that original event, which may trigger a PTSD attack or episode. Veterans, children, and women are among the most likely to experience this condition as a result of this traumatic event from their past. In a study conducted by the National Institute of Health, 70% of adults in the United States have experienced some type of traumatic event at least once in their lives, equating to approximately 223.4 million people.
Key signs and symptoms of PTSD include intrusive thoughts, avoidance of reminders or triggers, negative thoughts and feelings, and reactive behaviors. Intrusive thoughts include things like repeated memories or flashbacks of the event. People suffering feel like they're reliving the event all over again, and with these vivid memories can cause physical symptoms like sweating or increased heart rates. People suffering from PTSD tend to avoid people, place, events, objects, or situations that can trigger any memory regarding the event in order to avoid stressful thoughts or feelings. And with this can make it harder to function in everyday life. Negative thoughts and feelings include distorted beliefs about oneself and an ongoing fear, guilt, anger, or shame. They also show lack of interest in things that once made them happy and feelings of attachment or disconnect from people, especially their loved ones. Reactive symptoms include angry outbursts, irritability, reckless behaviors, or being self-destructive. People tend to be easily startled, have trouble with sleeping and concentration, and constant feelings of being on edge or tense.
The following specifiers may be used to specify onset and duration of post-traumatic stress disorder. Acute. This specifier should be used when the duration of symptoms is less than 3 months. Chronic. This specifier should be used when the symptoms last 3 months or longer. With delayed onset. This specifier indicates that at least 6 months have passed between the traumatic event and the onset of these symptoms. Normal stress. A normal stress response occurs before PTSD begins. Normal stress responses do not lead all and everyone up to PTSD. All humans react to stressors or dangers in some different ways. Events like accidents, injuries, illnesses, surgeries, abandonment, and reasonable amounts of tension and stress can all lead to a normal stress response.
Psychotherapies in general usually last 6 to 12 weeks or longer, one-on-one or in a group. Psychotherapies help overcome PTSD by teaching about trauma and its effects, using relaxation and anger control skills, help people identify and deal with guilt, shame, and other feelings about an event, or focus on changing reactions. People with PTSD can self-care by talking to their doctors, engaging in exercises to reduce stress, or setting priorities, and spending time with others and confide in loved ones. Cognitive processing therapy focuses on changing negative emotions such as shame, guilt, and beliefs due to trauma. Therapists help the person confront memories and emotions. Prolonged exposure therapy is when repeated and detailed imagining of trauma or exposure is triggered in a safe, controlled environment to help patient confront and control fear and distress, to learn eventually how to cope. This gradually exposes them to their trauma and helps them cope. Group therapy is when survivors of similar traumatic events share experiences and reactions in a non-judgmental setting. This way the person can feel less alone in their disorder and be able to talk through their issues. Medication can help control and help them more in psychotherapy. Antidepressants like SSRIs and SNRIs are used. This can be taken with or without psychotherapies.